I've mentioned in past weeks when we talk about Ebola how we really need to be thinking about the flu and how there's this kind of disconnect in terms of the panic around Ebola versus that of the flu, given that the flu is going to kill many, many more people in the United States in the coming months. Henry Miller wrote a very interesting article in Forbes where he says flu dwarfs Ebola, not only in ease of spread, but also in its potential lethality to large numbers of people. The Spanish flu pandemic of 1918 to 1919 killed more than 500,000 Americans, according to public health authorities at the time. I think that this is just great that we're actually getting coverage of this. Remember, two nurses contracted Ebola while caring for an Ebola patient. We have this nurse, Casey Hickox, who was initially mandatorily quarantined upon returning from treating patients in Africa. She still is not showing any symptoms, and she was allowed to go after potentially going the legal challenge direction, was allowed to kind of self-quarantine, and she was recently seen riding a bike. Right-wing media flipped out. But the reality is, flu is going to kill, by every estimation, way more people, Lewis, than Ebola is going to. And still, you see anti-vaccine conspiracists insisting that the flu vaccine is bad, but we should be really scared of Ebola.
Yeah, a lot happening around this. And of course, there are people who are more at risk when it comes to the flu than others. If you have, a weak immune system, certainly you are at higher risk, and you should probably consider getting the vaccine. Like I've said before, I don't bother with it. I don't think I need to. But don't let that persuade other people not to.
From the article, although we no longer experience flu deaths on the scale of Spanish flu during a non-pandemic season, on average, the virus still kills thousands each year in this country. You have to remember that when we look at the numbers of flu-associated deaths, remember that there are people who die of something like pneumonia who also had flu-like symptoms that are sometimes included as a flu-related death. So while the numbers may not be exactly what they are presented, we still have to think about this in the broader context. And according to recent estimates from the CDC, in 6 influenza seasons starting in 2005, flu vaccination has prevented around 13.5 million cases, and as a result has prevented about 6 million medically attended illnesses and about 113,000 hospital admissions. People panicking about Ebola while still choosing not to get the flu shot, it doesn't make sense.
And let's remember that the nurses who contracted Ebola probably did something wrong in procedural wise when caring for Ebola patients.